Hello and welcome to Diaspora Vibes from the TV47 headquarters right here in Nairobi. Good to be with you this evening. My name is Alan Owino and our sign language interpreter for today is Josephine Ouko. Let's kick off the bulletin. The head of the World Health Organization, Tedros Adhanom, alongside a panel of doctors, earlier today gave a world-over update of the COVID-19 pandemic. Tedros said that as the world enters the fourth month since the start of the pandemic, he is deeply concerned about the rapid escalation and global spread of infection and hopes nations are ready for a rigid fight against the virus beyond shutdowns and that in partnership with the World Bank, a worldwide economic solution can be reached upon.
As you know, this is the first ever coronavirus pandemic in the world, meaning there are many unknowns. And whether we do shutdowns or take other measures, we have to understand that we're in a learning process. WHO recommends the use of medical masks for people who are sick and those caring for them. However, in these circumstances, masks are only effective when combined with other protective measures. WHO continues to gather all available evidence and continues to evaluate the potential use of masks more broadly to control COVID-19 transmission at the community level.
This is a deadly virus. People will get through it, countries will get through it, but we must build the architecture of public health, the architecture of our health system, if we're going to get out of an interminable cycle of economically punishing lockdowns and shutdowns. We must get back to be able to control this virus, live with this virus, develop the vaccines that we need to finally eradicate this virus. This is about adapt, adjust, implement, measure, do it again. And you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't.
This is a virus that can be very serious in individuals, and so it's a real threat. It not only has public health implications, but it has very strong social and economic implications. And everyone needs to understand that they have a role to play. Every person has a role to play in this pandemic.
The relief processes are actually lengthy, but what we're proposing together with the World Bank and IMF is an expedited process to support countries so their economy will not be getting into crisis and their communities will not be really getting into crisis.
Right, we definitely do hope they get a solution to this deadly pandemic in due time. Let's now move on to other stories. Amid South Africa's lockdown, 69-year-old grocery seller Lucy Malimele, one of the country's millions of informal workers, says she is forced to break curfew in order to feed her family. Take a look.
Great-grandmother Lucy Malimele says she has to break the law to survive. She's sold fruit and vegetables from a stall since 1983, one of millions who work in South Africa's informal sector. But amid a 21-day lockdown, the army and police have been coming to close down stalls at Soweto's Kliptown market. As the sole earner in a family of 8 grandchildren and great-grandchildren, the 69-year-old says she's had no choice but to keep breaking curfew, even though her pool of customers has dried up.
There
is no business, meaning the business is dead unless I break the law like I currently am. As I got some produce, which is not allowed, but I still went to get it. Being here is not even allowed.
In an economy already suffering recession, power shortages and high unemployment, South Africa has not promised massive fiscal stimulus to cushion the blow like some other nations. It has brought in some measures for small businesses, but not offered any support to the informal sector, which Statistics South Africa says accounts for 6 to 7% of GDP. The World Bank says out of all South Africans currently working, 25 to 30% operate in the informal economy. President Cyril Ramaphosa has said the government is urgently developing additional measures to provide relief for informal businesses. But he has not specified when measures would be announced. For workers like Malimele, that means waiting for the lockdown to end and hoping for a return to business as usual.
The lengths our mothers would go to just make us safe is unmanageable, so unimaginable. So I want to send my heart out to every single one of them. And I know my mom is watching, so thank you wherever you are. Let's now move on. South Africa, which has the highest number of coronavirus infections in the African continent, is now sending testing teams into townships amid fears that they could provide a fertile breeding ground for the COVID-19, such as Alexandra near Johannesburg Financial District, where health workers tested residents and then after confirmed a case that was reported in the densely populated area. Take a look.
Testing teams are being sent into South Africa's townships amid fears that crowded conditions could provide a fertile breeding ground for COVID-19. The focus is initially on hotspots where infection rates are highest, such as Alexandra near Johannesburg's Financial District. Health workers tested residents there on Tuesday after a confirmed case was reported in the densely populated area. Norman Reid is the chairman of clinics in Alexandra.
So there's two people are very sick, and they are going out now.
Health Minister Zweli Mkhize said the government is scaling up its response because of concerns about internal transmission in the townships, and it plans to double the size of its testing teams. In Alexandra, some like Nono Zita were nervous.
I have to be scared because I don't know my results yet, because this sickness is a serious disease. People are dying, so we are taking it serious.
South Africa has the most cases on the continent and has imposed some of the toughest restrictions, including deploying the army to support police implement a 21-day lockdown that started on Friday. As of Wednesday morning, Africa's most industrialized economy had reported over 1,300 cases and 5 deaths.
Right, South Africa taking very stringent measures with regards to curbing the spread of the virus. As you've seen, they've sent people out there to go and test each and every single person just to see if they can curb this early enough. Now, at this point, I'll be joined by Godfrey Walker, who's the communications officer for SHOFCO, which stands for Shining Hope for Communities. Godfrey.
Hi, Alan.
How are you doing?
I'm good. Thanks for having me.
Sure thing. Now, let's just dive into what we had for today. SHOFCO is an organization based here in Kenya that has been helping different people in different slums, and your major slums is Mathare and Kibra. Yes. Now, since you started the operations of helping these vulnerable people with regards to the COVID-19 virus, how has that been?
It has been crazy because I think, as you understand, it's a pandemic. No one expected it, and it has come with a lot of challenges.
Yeah.
Mostly, a lot of people in the slums were not prepared. The government didn't expect it, and also, obviously, most organizations didn't have plans or budget for such pandemics.
All right. Now, we've seen different people from different places going to offer help to these people in the slums and in the vulnerable situations. We've seen players from Harambee Stars go outside there. We also saw Mercy Mariga herself going to do something for the people who are not able to get access to these services right at the moment. Now, they also got some backlash from people online saying they were exposing the people to this virus, and themselves also not taking care of themselves because they were not implementing the social distancing precaution that was given. What's your take on this whole situation? How do you, as SHOFCO, stick to this precaution of social distancing and still at the same time offer you services?
Yeah. To be honest, there's been a lot of online bashing in regards on what most well-wishers have been doing.
All right.
And a lot of people have not been observing the directive and the guidelines that the government set, especially on social distancing and hygiene. For us, if you come to the both in Mathare and Kibera and see what we are doing, we have been maintaining the social distance and at the same time encouraging the locals to practice hand washing. So what I'd like to advise other well-wishers is to try and work with organizations that are based in those communities, try to work with the local administration so that they can assist in like making sure that the government guidelines and directives are adhered to.
All right, now one thing that is looming or is just probably going to happen in the next few days, people are foreseeing this, is a lockdown. And I know this has not been accepted or received well by different people across the board, and the people who are going to be affected are the people who live on a day-to-day basis, like from paycheck to mouth, hand to mouth. Those are people who will be affected with the lockdown. Now you interact with these people on a day-to-day basis. Say that lockdown is implemented tomorrow. Do they have an alternative, or how are they going to treat that situation?
To be honest, that's a time bomb. You'll allow me to borrow from an article that was done by Kennedy Odede, my boss. It was on 26th of Thursday.
All right.
In regards to most of the directives that were set by the government. A majority, a bigger number of the people who live in slums, they survive on a hand-to-mouth basis.
Yes.
When in case the government will impose a lockdown to them, it will be a survival against, let's say, they love to choose in between their health and their daily survival, which, of course, all of us know they'll choose for the daily survival. And in case this lockdown will take longer than it is anticipated, it will turn into be a class issue. We might end up having a class warfare, because they'll start looking for other options. Where can they find food? Who are their neighbors, the neighboring estates? So it's a time bomb. It's something that needs to be looked in and given a deep thought before the government makes that decision. Definitely. Because apart from the issue of food, there's the issue of water, sanitation.
Yes.
COVID-19, it's more of like a sanitation problem. Right. Because it involves a lot of hand washing, a lot of hygiene. So these people, they share one toilet, they share a bathroom. We find like 50 families sharing a toilet, sharing a bathroom. How do you expect these people to survive in a lockdown? How are they going like to move on like their daily life? Yeah, because a family of 10 people sharing a 10 by 10 room, practically it's not something that is going to be easy.
Yes.
Yeah.
Now you've mentioned something really important in your explanation. You talked of these people getting other options that are not necessarily good, so to say, for lack of a better word, meaning they might actually resort to stealing, they might resort to crime, because they've been pushed to the very end of the world. Now, as an organization, Shofco, are you guys educating these people that in the event that this happens, this is how you can treat it? Is there any form of education on the event that the country is put in a lockdown, other means they can choose to survive with other than going through the crime and crime path, so to say?
Since the first case of COVID-19 was announced in Kenya, what we did through our Shofco urban network, in Mathare we have 26,000 members who are direct beneficiaries of the Shofco urban network. In Kibera we have more than 40,000, and also we have we are still doing the same program in Kisumu, Mombasa. So what we did, we normally have a team of zonal leaders in all our slums that we work. So what we did is that we called a meeting, and we invited health officers and also our health team. So we took them through a training on what they need, like to do, sensitize the community on things they are supposed to do, like social distancing, looking at the government directives. So after that, we've been having like door-to-door sensitization sessions with them. Like they tell us, in case of this and this happens, basically people are fearing the lockdown. That has been the biggest issue. Yeah. So we have been trying to have discussions with them. What other options can we look at? What other cost-cutting measures can they look at right at this point, so that they can try to save whatever they can save at this point. But to be honest, it's not achievable, because most factories have shut down. A lot of people, like for the women who go to wash clothes in those high-end places, they're not allowed to go to those places anymore. So it again brings the issue of the well-wishes and the government.
All right.
Yeah.
Okay. Now, just to wrap this up, SHOFCO, just like any other organization, is a non-governmental organization, and you depend on donors and personal sacrifices from people just to keep your programs afloat. And you've seen different organizations from across the globe. In Europe, they've been making pleas and asking the government to not forget them during this time, because they need to keep their operations afloat. What is the current situation with SHOFCO? Are you getting some form of help from the government or the necessary donor countries as we speak?
It's tough.
Yes.
We didn't anticipate we will find ourselves in such a situation. We didn't have any budget for that pandemic. So we've been pushed to work with the emergency budgets, which still are not enough, because since this pandemic first hit our country, we have set up more than 200 hand washing points, which are very costly. On the other hand, we have a very big team of staff that have been moving around doing sensitization together with the community members and the SAN members that have joined them. These costs were not anticipated.
Yes. And
it's very hard for us, because the European countries where most of our donors are, they have also been hardly hit with the pandemic. Meaning most of the concentration right now is in the European Union. So we are calling on local leaders, well-wishers, the government, to support such initiatives that SHOFCO has been doing, so that we can try to reach out as many people as we can, try to reach out as many households as we can, and try and sensitize them and prepare them on what is coming ahead of us. Yeah.
All right. So just before we wrap this up, from your perspective as an individual, live alone SHOFCO as an individual, you've definitely had different experiences, interacted with different people, leaders, and what, from your personal perspective that's not influenced by outside noise, what can we do to help us get through this without hurting all the parties and the stakeholders within the country?
It's a very tough situation for everyone, and right now the government has issued directives and guidelines. So what we need to do is try and follow the government directives and guidelines, try and follow what WHO has been advocating for. But again, we have to understand that apart from these guidelines, there are those personal decisions that we also make. If we don't have anything important to do outside our houses, we can choose to stay indoors, just to try and cut down on the spread of the virus. If we can try and get in touch and try to educate more people outside there who don't understand how the virus spreads, how they can protect themselves, this is the right time for us to do it. We should also make good use of the social media. Instead of bashing those people who have come out to support others, or to the survivors who came yesterday, to give their experience, this is the right time to use that social media in a good way to educate others who don't understand much about the virus.
All right. Now, even as you run your operations, there's always an issue of understaffing, and we have so many people who are back at home and are probably restless wherever they are seated, and they'd love to volunteer and get on board and help. Are you taking any volunteers? Would you advise people to volunteer, or just let the people who've been charged with this to continue?
We are taking in a lot of volunteers. A lot of people have been coming in from different institutions and different corporates who want to volunteer and to issue donations. So we've been welcoming them. For instance, at our clinics, we have clinics in Mathare and Kibera. More than 5,000 people since the pandemic hit our country, they have come to our clinic to be screened. It means we need a lot of human resource. Basically, a lot of things. We need a lot of support. Anyone who is willing to volunteer, anyone who is willing to bring soap, anything that can support during this tough time is highly welcomed.
All right, Godfrey Walker, thank you very much for your time, and I hope everything goes well with Shofco in your plans in terms of helping us fight this. You guys are the real heroes on the forefront of this war. All right, you had Godfrey say what he said, and he said a very important thing, that if you don't have anything important to do, stay at home. Just stay at home, and you probably could help with this fight. Don't be out there doing something that you're not supposed to be doing. And secondly, they're also taking in volunteers to help with their operations, because at times they might get understaffed and they really need help in whatever way. Soap, anything that you can come up with to help, please do and reach out to Shofco. All right, at this point, we'd love to take our first break. Don't go away. If in case you're joining us right now, remember the platform that you can use to communicate with us. It's at TV47KE, or you might as well send me a direct tweet on you might send me a direct tweet on @com or with the hashtag Diaspora Vibes. Don't go away to stay with us.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
The best way to stop any viruses from spreading is by washing your hands. But did you know by using any soap, you could get rid of all disease-causing germs? The fat layers that attach the virus to the hands get pulled out, and the soap demolishes these viruses. It takes at least 20 seconds for this effect to take place. You do not have to go for soap marketed as antibacterial. In fact, the US FDA recommends you skip it. There is no evidence that it kills germs better than ordinary soaps. This message is brought to you in the public interest by Imperial Leather.
For more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
right, thank you very much for staying with us right here on Diaspora Vibes. Now, before we continue, I've just received a text on my direct line where I think it's a viewer who's viewing us from the digital platform, and he was like, we were watching you and you just disappeared. I think when we are on a break, the live stream comes to a halt, and you should be able to see me right now, so continue with the viewing. Let's now move on. The world's greatest marathon runner says we will win this fight against COVID-19, though he has not yet decided if he will compete at the Tokyo Olympics, which have been postponed until 2021. Kipchoge Keino gives his thoughts. Let's listen in.
Eliud Kipchoge's first reaction on hearing that the 2020 Tokyo Olympics had been postponed was shock. But now the world's greatest men's marathon runner is feeling defiant.
The world will actually beat these fighters in the next 1 month, and maybe in May we are able to come back to our trainings and resume in a big way, and we'll win this fight against the COVID-19.
The Kenyan, who last year became the first to run a marathon in under 2 hours, has not yet decided if he'll compete in the rescheduled games in 2021.
You know, still early. Still hard to say some things, but let the year end first, and then we'll make a big decision after the year ended.
Speaking from his home in Kenya's town of Eldoret, Kipchoge said that right now he's just concentrating on the safety of his family, and he is still exercising, though he says running is harder on your own. And does have some advice for everyone else at home under lockdowns.
Just have some steps to run on. Just let us give it. Both physically and mentally, by reading some newspapers, be with the family, watch good movies together, which can make us and the days move, and you get more knowledge. So that's my message to all. But above all is that should be disciplined in order to be fit. We should be disciplined and respect what healthy organization has said, and together within a couple of months to come, this COVID-19 will go away.
My apologies for that. I mentioned Kipchoge Keino, but that's Eliud Kipchoge. Sorry for that. So as we continue, we now want to shift our focus back to our immediate neighbors right here in Somali. And Somali doctor Yusuf Ahmed has escaped an execution, battled deadly diseases, and treated war victims. Now at 35 years old, he's been tapped to lead his nation's response to the coronavirus pandemic. So far, Somalia has only 3 known cases. But if the disease is unleashed, it could race like wildfire through the camps of malnourished families huddled under makeshift domes majorly built from sticks and rugs.
It is a comprehensive plan that is preventive and that includes self-isolation, quarantine, monitoring, psychological support, and awareness. We prepared this plan last month with a budget of $7 million. It is just the first step because the Prime Minister has announced that he will help the plan with another $4 million. The elderly, poor, malnourished, and other with weak immunity are prone to the disease. Meanwhile, Somalia is a fragmented country and all its facilities have been destroyed. We have no intensive care unit ready at the moment. We are still preparing. We have few medics that are now trained to work in the ICU. We have very few health facilities. 80% of coronavirus patients usually survive, but the elderly and the weak need modern intensive care, and we have no ICU that will meet their specific needs. We have trained more doctors and nurses. The preparations are going on for another month. I do not have the exact figure, but there are even doctors and nurses who have come from the States to be trained. Public hospital staff were also trained.
All right, as you have seen, that is the current state of affairs in Somalia, where they have confirmed 3 new cases of the coronavirus victims. And the government is just really scared that in the event that this is supposed to blow up, it could turn into something else. Because, as you know, most people living in Somalia are IDPs and they live in concentrated camps. And they are worried that could actually turn into something else. Now, I'd love to rope in somebody where we want to cross over to Dana Hughes, who's the Senior Regional Communications Officer of the UNHCR, and we'd love to get a perspective from her side. Dana, thank you for joining us.
Thank you very much for having me, Alan.
All right, now just to start this conversation, could you tell us what the refugees generally are going through across the globe and in different places? What's the situation for them on the ground?
Sure. Well, Alan, as you know, most refugees live in concentrated areas, whether that's in camps or in settlements or even in urban environments, where they have limited access to water, to sanitation, and also to health care. So, that could leave this population extremely vulnerable to COVID-19. What we are trying to do is work very closely within national governments to make sure that refugees are part of national contingency plans, and so that there's not any kind of parallel planning, and so that refugees and displaced people are not left behind.
Right. Now, just as I was going through my readings earlier on, there's a report that was published by Refugee International, and the title of the report was COVID-19 and the Displaced, Addressing the Threat of the Novel Coronavirus in Humanitarian Emergencies. And one of the key findings in that report is that the personnel that are charged with helping the people in the camps, they've realized that they are not well equipped with the necessary equipment to actually aid them in this work that they're doing. What is the situation with regards to how well equipped the people are in those camps in handling the people?
Well, I think, we have been working on preparedness for this since the beginning of the crisis, before it even came, I know in this region, before there was even a first case in sub-Saharan Africa, we had began working with national governments and training healthcare workers, trying to get in more medical supplies based on WHO recommendations. I think one thing that's really important to realize is that this is an unprecedented and historic global pandemic. There is nowhere in the world where healthcare professionals are feeling like they have enough equipment to properly fight this. I think what we're all trying to do is follow as much as we can the WHO guidance. And to that end, particularly when you're talking about refugee camps, particularly when you're talking about camps and communities in countries that do have fragile health systems, whether you're talking about refugees, whether you're talking about people that live in slums, I think there is an acknowledgement by many African governments and governments in Latin America and in the Middle East and in Southeast Asia that, this is a pandemic that is really decimating even traditionally more equipped countries. So that's why prevention is so important. And that's also why UNHCR has launched this $255 million appeal to assist us in continuing with the prevention, and then also to assist us with our contingency planning, being ready to perhaps airlift supplies and equipment if it comes to a place where we cannot get equipment and also supplies and emergency supplies needed in through traditional ways. Okay. This is also being used to help us with better mass information campaigns and hand washing stations, soap distribution, and also to equip isolation areas that have been identified with the help of WHO and in line with national governments.
All right, now let's just move on. There is let's just bring this home. We have over 400,000 refugees in Kakuma and Dadaab camps, and there was a video that surfaced just the other day where a Ugandan in Italy talked of the government not providing food for the non-citizens. Like, if you're not a citizen of Italy, being provided with the essentials that the government was providing with the people.
Right.
So what I'm trying to get from this is, do you see a similar situation in the African context? Do you see where governments can get to a point where they are not providing for the non-citizens and only providing for the rightful citizens of their country?
I don't, Alan, and I'll tell you why.
Yes.
I think this is why we are very much advocating that refugees are part of any national contingency plan. And in Kenya, we've worked very closely with the Ministry of Health. We've worked very closely with Ross, with the Refugee Affair, with the Interior Ministry, and also with local governments in both Turkana County and Garissa to ensure that refugees are part of the planning. And it's really important that that is the case, because as we've seen, coronavirus does not discriminate against anyone, and it is easily transmitted. And it's a situation where, making sure that refugees, displaced people, host communities, that even you could broaden it to say that the global south, some of the more fragile countries, it's not just about protecting refugees or displaced people. In the end, without proper planning for everyone, you put millions of lives at risk, and you risk the virus coming back around to the rest of the world. And, we do have situations already in place. However, when you're talking about feeding refugees in Kenya, you have, programs with WFP, you have programs with some of our partners. We are definitely not doing this alone. And so in that case, we are looking at perhaps different ways to distribute food. Maybe we do not do, several large gatherings to distribute food. I know in Kenya, we're looking at doing it maybe once a month, so that we limit the amount of time that people have to come together to collect food. But I don't see that really happening in Kenya, and I don't really see it happening in the African context.
Right. Now, just as we wrap this, from where you're sitting from, even if the government and the people living in the slums and the depleted conditions, if they were to take the necessary measures and precautions, would it be enough to help the situation with such living conditions down there?
We hope so.
Yeah.
We're doing everything that we can to ensure that doesn't happen. And then we're doing everything, we hope for the best, but we're also making plans for the worst. And that includes, working again very closely with the government, but then also upping our protection monitoring. And in this case, this is when we really work closely with refugees. And a lot of times, a lot of the same advice: don't touch your face, wash your hands, try to practice social distancing, don't go to large community gatherings. If you're feeling sick, let the right people know. The preparation and the communication within refugee communities, really training and using refugee community volunteers is so key to this. And one other thing that I would say is that, you can't forget that in Africa, we have dealt with pandemics before. In Uganda, for example, some of what they're doing is just is just increasing some of the same processes and skills that they acquired during the Ebola pandemic. So, we cannot guarantee that there will not be an outbreak, just like nowhere in the world can they guarantee. Again, we are living in unprecedented times, but we are certainly doing everything in our power to be as ready as we can be.
All right, Dana Hughes, thank you very much for your time.
Thank you very much, Alan.
All right, that was Dana Hughes, and that is the situation with regards to the people living in the slums and the refugees. We hope that all works well for them. At this point, we'd love to take our second break, but don't go away. When we get back, we'll be returning with the Returning Diaspora segment. Stay with us.
My name is Sujata Kotam Raju. I'm the National General Secretary of Hindu Council of Kenya. Namaskar to my dear sisters and brothers. Now this is the time everyone will have to take the responsibility to fight against this virus, not to spread further in this country. If at all, if you want to go out, maintain the social distance. Avoid going to the enclosed areas like supermarket, temples, churches, and any religious functions. Avoid shaking your hands and hugs, any form of physical contact. You can just say namaste. For more information, dial 719 or *719#. Kamesha Corona.
Now, welcome to this beat of the show where we have a a guest in studio where we want to discuss and just get a story of his time and stay in the United States before he got back to the country, and has been up to a couple of things. And joining me today on Returning Diaspora is Dr. George Njoroge, who's the founder of Coles. Dr. George?
Oh, thank you very much, TV47, for inviting me to your studio through Alan Owino. I really appreciate this opportunity to talk to you about my experiences. Yes, my name is Dr. George Njoroge, and I was born and raised here in Kenya. Went to my primary school in Kiambu, and then my high school in Thika High School, and attended my earlier university education at the University of Nairobi, Chiromo, and moved to United States back in 1981, and that's where I did my doctoral studies, graduating in pharmaceutical chemistry. Then worked with various companies in the United States that I might talk about, and then I'm on my way, or I'm back to Kenya to give back to our motherland.
All right, now just before we get to the point where you decided to come back home, where did this love for biochemistry and the love for medicine and research come from? Like, how did you discover that this was something that you wanted to do?
Yeah, actually this started right from my high school days. I had a very interesting biology teacher who took me to the life of living things, and I got very excited how the human body works, and and also I had some exposure to some of the work that my maternal grandmother used to do. She used to get some herbs, and make some concoctions that she used to provide to people with various sicknesses. And I was amazed to see some of them were working, and I thought when I become as I get into science, I would try to figure out why some of those things were working, and maybe even make them much better.
All right. Now, you spent your time in the States and you got back to the country. When you get here, you decide to actually venture on a big project, which I believe is already en route. It's taking course, it's taking shape day by day, and this is the COLS, which is the Center of Africa Life Sciences, right?
Right.
All right. So just tell us about this whole project, because I read about it and it's a super amazing project from the concept that I read and the articles that I've been through. Tell us what this project is all about and what it means for the future of Kenya.
Thank you, Aaron. Actually, this didn't just start when I came back. This is something that has been in the offing for maybe the last 10, 15 years, thinking about it. As I said, I finished my PhD work back in 1985, worked for pharmaceutical companies, doing research, discovering new drugs. My first drug that I discovered that went to human beings was back in 2011, a drug by the name of Vectris for hepatitis C. And there are several other drugs that came thereafter. And it's at that point when I did all this work where I was a director of research, manning maybe, or actually working with more than maybe 100 PhD counterparts. That's when I realized, after doing all this work in the Western world, I need to come back and give something back to my motherland. So I've been thinking about it, and the way I was thinking about it is, how can I bring all these people that I've been working with, or some of those people, and bring them to Africa where they can enjoy doing some science, nurturing some of the young people here, and developing to be good scientists and discovering medicine here in the continent of Africa. That's where the whole thing started. And then when I got to a point where I felt that I should now retire from US, I just came back end of last year and started this project, which I'm sure we're going to talk a little bit more about it. And it's a very exciting project because it's going to incorporate not only people from Kenya or Africa for that matter, but the people from other parts of the world.
When you speak of science, there's always one thing, there's always a critical and issue that people grapple with, is that science, I don't know if it's an assumption or it's true, science is perceived as a complex subject or field for very many young people. What have you done to actually incorporate the young people into this concept that you're trying to bring out?
Science is complicated. It's not rocket science, it's even actually...
So it's not an assumption, it's true, it's complicated.
It's true, it's more complicated than rocket science. But that's a very nice question, because it's something I've been dealing with for quite some time now. And what I should actually be addressing to not only you and even to younger people, but more importantly to our scientists. Science is complicated, but you can simplify it depending on who you are talking to. And the more you simplify it and make it, people, go to a level where they can understand it, then they will start appreciating.
Times have changed. It's been a long time since you were in the States back in the 80s and right now. Tell us, how was it living there as a black person from a different country? You've just gotten into the States. How was life then?
Well, it was tough, especially when we went there, but it all depended on your mindset. When you go there, everybody looks down on you. They think, this guy coming from Kenya, what does he know? He just learned his English on the way here. And when you go to class, I think when I went to my first class, we were only one gentleman from Nigeria and myself, and the rest of them, 60 of them were white people. And they start asking you, you do a test, they ask you how was the test, we are model, we are modest, we start telling them, I think it was a difficult one, and they told me, they tell you, I aced it, but then later on when the test comes back, he hasn't done as well as you've done, and then, but it was tough, but as we went along, they started recognizing that there is talent in Africa, and they start appreciating who you are. Then when I went to industry to work in the industry, I was given responsible jobs, and it was tough trying to tell them that even the white people, you could manage them. I was managing maybe 50 people, and most of them were whites or the Asians, but it was difficult for them to take it that they're going to be directed by a black person. But when they realized what stuff you had, they would later